The shoulder is a large ball and socket joint with lots of motion. And the technological advantage of arthroscopy has allowed us to diagnose many injuries that we could not diagnose before. And the increased number of participants in sports and physical activity at both the younger age and at the older age makes the incidence of injuries far higher. Some of the most common shoulder injuries are rotator cuff tears, what we call the impingement syndrome, and shoulder instability after a dislocation. Now, rotator cuff tears and impingement syndrome are kind of a continuum of the same process, with a bone spur rubbing on the rotator cuff and causing a tear. In a typical rotator cuff patient, if it's a young person who's physically active and has a complete tear of the rotator cuff, we can tell them with great confidence that it's going to get worse and give you lots of trouble if we don't fix it, so you probably don't do as much conservative treatment before that. On the other hand, if someone is 65 and has a small complete rotator cuff tear, it is very reasonable to say, let's try medications, let's try some intra-articular steroid injections, let's try physician-directed physical therapy, and at the end of that period of time, you let the patient decide. If you are not at a satisfactory pain level or level of function, then that's the time to discuss surgery. Recovery after a shoulder operation generally depends on one very basic principle. At the time of the operation, did you reattach something to the bone or sew two tendons together? Or did you do an operation where you simply removed something that was causing pain? If you just remove something that's causing pain and you do it arthroscopically without disturbing the tissues getting into the joint, the recovery is very rapid, 1 to 3 weeks. However, if you have reattached a rotator cuff to the bone, it still takes Mother Nature 6 to 8 weeks for that tendon to heal to the bone. Rotator cuff repair in a young person should have a 90% success rate in experienced hands. Now, in a patient in their 60s or 70s, the success rate of getting a complete healing of the shoulder is less, but the success rate of patients being much better and having less pain and greater function is very high.